My name is Amy Crumb. I'm the Certified Athletic Trainer at Greenup County High School. I have been here 20 years and I cover all the sports here at the high school, ranging from football and soccer and volleyball in the fall, cross country, and in the spring I'll cover baseball, softball, track and field, and then during the winter time we have our basketball teams and our cheerleaders. As a certified athletic trainer here, my role would be if an athlete comes in and has diabetes, I need to communicate between the parent, the athlete, and the coach and myself about the things to watch in that athlete, if they would become hypoglycemic or hyperglycemic, what are the things we need to do. The most important thing is to have an emergency action plan in place so you know when these things happen what you need to do for that athlete. Hypoglycemia is when the blood sugar decreases rapidly. So some diabetics, they'll have an episode where they feel like their blood sugar is decreasing. You check it, and it may still be in normal zones, but for them, they may have had a rapid decline. And they may have been at a good level when they started exercise, and all of a sudden they had a really drastic decrease. So you may check it, it may not be dangerously low, but they may have had a sudden decrease, and you've got to monitor that and get them glucose for that. Hyperglycemia is when their insulin is not taking care of the sugar, and their sugar is increasing rapidly. And it can get to high levels and can be very, very dangerous. Both levels can be dangerous. If they go too low too rapidly and get below a certain level, they can become unconscious, and also with hyperglycemia, they can be very dangerous. That's something you have to watch in diabetics also, is the heat can really affect them. It can affect if they're wearing an insulin pump also. The insulin pump may not be as efficient in the heat. So the insulin inside that may not be as efficient in decreasing their blood sugar. In emergency action plan, you want to have in place who will do what based on what the athlete is experiencing. So everyone has a role. So if you have multiple coaches on your staff, if a parent is there, you've got to have someone that's getting the glucometer, getting the glucagon just in case they would become unresponsive, have a place for them to go where it's cooler, where it's shaded if they're hyperglycemic and need to cool down, take some fluids in and cool off during the activity, have that in place. Who's going to do what? What do they need if they have A happening, B happening? You be sure you know what's going on. So what I've done with our coaches, we do have one diabetic athlete. So I made flashcards for the coaches. And what I did, I listed all the signs and symptoms that are possible in hyper and hypoglycemia. But then I highlighted the most common in that athlete. So when they look at this list, they'll be like, okay, they are experiencing one of the symptoms that we're supposed to be watching for, and they may be experiencing one new one that they don't normally experience, but they'll know that is a sign or symptom of hyper or hypoglycemia. And then they can flip over the card and they can know, okay, they're hypoglycemic. Okay, my action now is they flip over the card and they know, because everyone gets nervous in that kind of situation. So I think having it on paper allows that coach to reference back to, this is in the medical bag, they can reference back to it and know what they need to do in that situation. Exercise is wonderful for diabetes, but you must make sure you're communicating with your physician. If a child wants to start an exercise program, you need to communicate with your physician what kind of activity you're looking at, how intense you're going to be, and you can't just jump into something that's really high intensity all of a sudden and not know how your body's going to adjust to that. So make sure you do it gradually. Build up your intensity, build up your length of time of the activity, monitor your blood sugar before and after, during. Say you're starting out and midway through you start to feel weird. You think, am I high, am I low? You might want to check it then to see what the trend is for your body, because you don't know your body yet. So it's best to see what your body's going to do with the activity. Another important thing is in a life-saving situation for the athlete, they may need glucagon. This would happen if an athlete becomes hypoglycemic and they would become unresponsive. Glucagon will give them a sudden burst that they need and is life-saving for the athlete. So everyone involved in their care must know how to administer this in that situation. And here at the high school, all of our coaches that have an athlete that needs glucagon will be trained by the school nurse on how to administer that medication and when to administer it.
Newly diagnosed families with diabetes have to have diabetes self-management education. It's the most crucial part to understanding and battling the disease. So I'm Hillard Brown. I'm an RN, diabetes case manager and ambulatory care manager for King's Daughters Medical Center. It's my daughter Ashley Brown. She was diagnosed in 2009 with type 1 juvenile diabetes. You know, having a daughter, especially a teenage daughter with diabetes, it's hard because of sports and, you know, parties and what the friends are doing and things like that. So it's trying to find a balance between letting her be a kid and letting her enjoy things, and at the same time knowing that we have a disease that we have to manage, you know, to keep her healthy. So that's been the toughest thing we've had to deal with. In managing diabetes, especially juvenile with kids, you have to understand the symptoms, the signs and symptoms, the things to look for, the dangers that come with it. You have to know how to control it. You have to know about counting carbs and foods to eat, foods to avoid, timing of meals. There's a whole lot of things that goes into controlling diabetes. It's not just eating and taking a shot. You have to have the knowledge to be able to understand what you're controlling, to be able to control it. You know, having a child with diabetes is a lot different than having an adult dealing with diabetes, because kids are kids, and kids are going to have birthday parties, and there's going to be cake, and there's going to be ice cream, there's going to be all the things that kids enjoy. Having the education and knowing that your kid can still be a kid, they can still do the things that their friends are doing, they can still be involved in all the activities, sports, parties, driving, everything that goes along with growing up and being a normal child. Having that education and learning that all those things still exist for the child with diabetes. Nothing changes. The only thing that changes is now we control diabetes from the outside of the body instead of the inside. I usually recommend before a sporting event, you do a higher carb meal mixed with good proteins, and they have to be complex carbs. They can't be simple sugars that are going to break down fast. You need something that's going to hang around for the duration of the sporting event. You know, pastas are okay. Peanut butter is really good to have with crackers and bread, but you have to have a good combination of proteins and carbs to make those carbs last. The quick fix candy before you would play a game, that's not a good choice. You have to have a good combination and balance of protein and good carbs. So for us, the scariest thing that we've ever had was Ashley waking one morning and being unresponsive. New Year's Eve morning, we had, of course, candies and cupcakes and things left over from Christmas, and we had made for New Year's Eve party. That morning, we went to wake Ashley up, and she wouldn't rouse. We would shake her, we were talking to her, you know, all the things that you would do to get someone to awaken, and she wouldn't. And that was the scariest thing. And for me, you go instantly from being dad with a child with diabetes to a nurse with a patient with diabetes. So I ran to the kitchen and I grabbed some cupcakes, and I just fingerfuls of icing off of it, you know, stuck it in her cheeks to get the sugar back up, to get her to come back around. Once the sugar started coming back and she started coming around, then we monitored real close for the next several hours to make sure the sugar stayed up. Got her some good complex carbs with some proteins to keep the sugar up. So that's been the scariest thing for us, and those are the things you think about every day, and those are the things that everyone with a child with diabetes worries about. But here again, I take this back to the education. If you know how to handle that situation, you don't have to be a nurse. You can just know how to handle the situation. You get that from the education, and you react quickly, and you resolve the issue.
The 504 is a statement. It's a federal rule that says if I am to miss out on a test because of my sugar or anything related to my diabetes, that I am allowed to make it up. Any work that I've missed in a class period because of my diabetes, I am to make that up. They have set rules because certain diabetic patients have different symptoms. Some, when their sugar gets really high, they go to the bathroom a lot. I know I'm allowed to go and check my sugar whenever needed, and I'm allowed to make up what I miss. And especially with state testing, that was one of the big things on the 504 was if I am pulled out because of my sugar, I am allowed that time to make up that part of the test again.
And as a parent, having that 504 on hand at the school gives us some comfort that we've outlined before school starts, and we do it every year, we renew it every year. We've outlined, here's her ranges, here's where she has to be. These are the things that we want done as parents to help her control her diabetes at school when she's away from us. So it gives us the confidence in knowing that, okay, we put this in place. The school officials, the school nurses, they know what to do, and they know that it meets what we want and what her physician wants in the way of care. So it's one of those things that I think any juvenile diabetic should have if they're in school. And the awesome thing about the 504 is it actually carries on into college as well. So when she graduates high school and she goes on to college, that 504 will go with her. So it helps at the college level, not just at the high school level. So it's a wonderful tool that everyone should really take advantage of if they need to.
Advice that I'd give to a newly diagnosed athlete would be to always have snacks on hand. I always carry peanut butter and crackers and juice with me. Always have a water with you in case of those in case you have high blood sugars during a game or something. And always carry a glucagon pen in case you become unresponsive. And the glucagon pen is just sugar and water, and you just mix it together and inject into an area where it can get in their bloodstream fast to bring the sugar back up. There have been things that people have said like, oh, she's just using it to get out of class, or oh, you're lucky you get to get out of class to do this or do that. And I have to look at them and say, this is not something I can avoid. This is a serious situation that you control it every day. You never know whether it's going to go high, low. You don't know. I don't want to say it's a guessing game, but you kind of have to watch. I remember one time I had to come off the field. I was real shaky and my head was kind of spinning, and I looked over at the coach and he knew something wasn't right. So he said, take a knee. So I took a knee, and the referees immediately came over to me and helped me up and walked me off the field. And the athletic trainer came over and was helping and got me water and stuff to kind of cool me off and make sure I was okay. Then we checked my sugar and made sure it was fine. It was just, the coaches knew what to do and when to do it. They knew what the signs and symptoms were, and so did the athletic trainer. They all knew what to do.
So you have to have a plan in place for everything when you're dealing with a child with diabetes. You have to have a plan as far as what do we do if the sugar goes low? What do we do if it goes high? What about, how many carbs can you have, should you have? Those are the types of questions and the types of things that we plan for on a daily basis. We know when we go somewhere, we look at food, we look at nutrition guides, we look at everything to plan, no matter where we're going, what we're doing. It's easier to plan ahead than it is to get somewhere and have to second guess or have to try to figure it out when you get there. So Ashley uses an insulin pump for her insulin, and when I talk to people in the hospitals, I explain the insulin pump as this. It's the same thing as a pancreas, it's just on the outside of the body. She boluses for what she eats. The pump is programmed to know how much insulin to give. That way, there's no guessing. And we can do the math on the calculator, we can figure that up, but the pump takes the guesswork out of it. It makes ease of operation for her. We're not packing needles around all the time, we're not having to draw up insulin.
I can do everything that I was able to do before I had diabetes in the pump. It doesn't limit my ease of access to anything anymore.
I think the only thing that from a parent standpoint that I could see would be an issue is it's always trying to find somewhere to keep that pump when you're on the field and you're playing. Do you attach it to your shorts some way, or do you tape it to yourself some way? It's finding those unique ways that work for you to where it's not as noticeable. Easy to get to, but still yet not cumbersome. And we typically, and this is one of those things that you kind of play with, and it's trial and error, honestly, is you play with, do I wear the pump when I play? do I not wear the pump? And that kind of goes with what's my blood sugar before I start, what's my blood sugar typically when I get done, can I go that 2 hours without the pump, and just checking intermittently as necessary.